Do you have an autoimmune condition, or do you treat patients with various autoimmune conditions? If the answer is yes, I have some important information on the COVID-19 vaccine and its effectiveness. There is a general concern that the use of immune suppressing medications lead to decreased effectiveness of the COVID-19 vaccines. To better understand this concern, we are reviewing the current scientific evidence based on a large study which pooled all the available articles on this topic, which in publication term is referred to as a systematic review. This included 25 published articles in this topic. Patients with various autoimmune inflammatory conditions were included in this study. These diseases included inflammatory bowel disease, where there are two varieties, Crohn's disease and ulcerative colitis. It also included many rheumatic diseases like rheumatoid arthritis, spondyloarthritis, and vasculitis. These patients were on various immune modulating medications of various classes. The rate of seroconversion rates, that is, the percentage of people with protective antibody, was measured after first or second dose of the mRNA vaccine, either Pfizer or Moderna. Here are some of the highlights of the study. The rate of seroconversion was higher with 2 doses of mRNA vaccine compared to just single dose. Compared to healthy people, patients with inflammatory diseases had lower likelihood of seroconversion rate. The disease-specific conversion rate was lowest in vasculitis with 71%, and rheumatoid arthritis had 80%. Other inflammatory diseases such as inflammatory bowel disease, spondyloarthritis, and lupus had a higher rate of seroconversion. This likely reflects the difference in the medication used to treat these various conditions. Medication-specific seroconversion rate varies with different groups of medications. Anti-CD20 medications like rituximab and anti-T-cell medication like Orencia had the lowest seroconversion rate of less than 70%. Steroids, JAK inhibitors, mycophenolate, and leflunomide had 70 to 90% seroconversion rate. Anti-tumor necrosis factor inhibitors like Enbrel, Humira, Remicade, Cimzia, and Symphony had more than 90% seroconversion rate. The rate was also high for anti-integrin medication like Intavio, used for inflammatory bowel disease, anti-IL-17 like Cosentyx, anti-IL-6 like Actimra, and anti-IL-12/23 like Stelara, with more than 90% conversion rate. Combination of anti-TNF with other immune modulatory medication like Imuran, 6-mercaptopurine, or methotrexate resulted in a lower vaccine response as compared to monotherapy. Seroconversion rate after messenger RNA vaccine are lower in patients with various autoimmune conditions. Seroconversion rate was significantly lower with medications like rituximab and Orencia.